I'm called Dr. Alex Ario. I'm the director of the National Institute of Public Health in the Ministry of Health. So the Uganda National Institute of Public Health is a semi-autonomous institute of the Ministry of Health, which is now 10 years old. The journey to establish it commenced in 2013 with setting up of functional components until the year 2019, when the President of the Republic of Uganda directed its formation as an autonomous government parastatal. It is a science-based government institution which serves as a focal point for the country's leadership, expertise, and coordination to address public health concerns in line with global health security requirements. It works closely with partners and multi-sectoral government agencies at national and subnational levels to provide evidence-based leadership and proficiency for public health emergency response services, which help to catalyze disease detection, notification, and control in the country. And because the Institute is science-based, it is a trusted source of information and evidence for policy and decision makers for the One Health Consortium ministries and agencies. The Institute is multifaceted and composed of directorates with individuals with a wide range of skills and evidence who perform critical public health functions such as disease surveillance, research, prevention, preparedness and emergency management and response. The directorates are Epidemiology and Surveillance for Public Health Emergencies, Public Health Emergency Operations Center, Zoonotic Environmental and Emerging Health Events, Data and Analytics, Public Health Laboratory, Workforce for Health Security and Public Health Emergencies, Operational and Implementation Research. And it's managed by Finance and Administration Directorate. The National Institute of Public Health is headed by me, who is the director. Now, the Board of Governance of 10 members, which shall be appointed by the Minister of Health, will provide oversight role once the institute is legally established by an Act of Parliament. The capacity building components which are operational at the moment include the Uganda Public Health Fellowship Program, which is a postmaster's degree program, and its certificate awarding. And this includes the advanced field epidemiology and laboratory leadership, which are heavily supported by US government through US Centers for Disease Control and Prevention. The third one is the Health Informatics Program, which is supported by Korean Foundation for International Healthcare, COFI. The components of implementation science, prevention effectiveness, which is health economics, monitoring and evaluation programs are still at conceptualization stages. The intermediate and frontline field epidemiology training programs, which are also heavily supported by US CDC, are also operational. And this aims at improving skills on basic data collection, analysis, interpretation, and communication. And by improving skills, we are strengthening epidemiological capacity of district and regional teams to detect and respond to disease outbreaks and events of public health importance. We also have the Data Impact Program, which includes data to policy. And under data to policy, we build capacity of fellows and other Ministry of Health staff and officers to develop high impact policy briefs with economic and epidemiological data. The second component is scientific communication, where we strengthen capacities of fellows and Ministry of Health staff in presentation skills in conferences and also publications in peer-reviewed journals. The third component under Data Impact Program is the Public Health Bulletin, where we build capacity for fellows and Ministry of Health staff to publish within the Public Health Bulletin and also to produce the Uganda Public Health Bulletin, which for the third year running has been ranked the best public health bulletin in the world. And all these components I've mentioned are heavily supported by CDC Foundation. The fourth component of the Data Impact Program is data-centered leadership, which helps public health professionals in the Ministry of Health to advance their skills to manage with data and to strengthen data use practices. to enable their departments leverage available data more robustly. And this component of the Data Impact Program is supported by vital strategies in the United States. The other component, capacity building component, which is currently functional, is the Civil Registration and Vital Statistics Strengthening Program. Now, in this component, we work very closely with NIRA, and we focus majorly on establishment of a sustainable mortality surveillance system, capturing of real-time information on deaths from all regional referral hospitals and selected districts, improvement of death notification and facilities and community settings, and ultimately registration of deaths in a national death registration and identification system. So in working closely in partnership with NIRA and all the other relevant sectors, including WHO and UNICEF, and of course the academia, we have actually managed to strengthen many of these components. Now, this component of CRVS is heavily supported by CDC Foundation and Africa CDC. The other component is the disease modeling program. Now, the first program under disease modeling which we have implemented, which is supported by the Gates Foundation, is focusing on modeling women's health and building capacity of women modelers in the East African region, including Rwanda and Kenya. We implement it in collaboration with the National Public Health Institutes of Kenya, which is the Kenya National Public Health Institute, and Rwanda Biomedical Center, which is the National Public Health Institute of Rwanda. And then we implement it with academic institutions within the country, in the region, and around the world. And this includes Makerere University, University of Nairobi, University of Global Health Equity, Infectious Diseases Institute, African Institute of Mathematical Sciences, Harvard Chan School of Public Health, University of Maryland, London School of Hygiene and Tropical Medicine, and Africa CDC. Now, the program that we have started implementing is a very important program to us, and it's a PhD awarding program. And this one we are focusing majorly on digital health, health informatics, data sciences, epidemiology, health systems, mortality surveillance, and the areas we picked majorly at the moment is maternal and child health and infectious diseases. So this PhD program we are implementing closely in collaboration with the Norwegian Institute of Public Health, University of Oslo, Makerere University School of Public Health, Infectious Disease Institute, Ghent University in Belgium, and University of Cork in Ireland, and then Mountains of the Moon in Uganda. So these PhD programs are building capacity of PhDs, not only to strengthen the National Institute of Public Health, but to actually build the capacity of health professionals in Uganda.